Dr. Mayo, as we, kick it over to you, first of all, it's an honor to speak to, one of the last practicing Mayos in the industry. Everybody knows the Mayo Clinic very well, but, as we uh, think about your organization, as you look at the clinical aspect of MUSE Healthcare, do you believe in AI machine learning medicine? And does that help with the overall patient experience? I think is what's in everybody's mind.
Yeah, just a little bit about our organization, St. Croix Hospice. We have been around for 10 years. We started in Oakdale, Minnesota, and have since expanded into 6 Midwestern states. We have 700 employees, and we cover about 75% of Minnesota, Iowa, Wisconsin, Kansas, Nebraska, Western Missouri. And we have an ADC of about 2,000 patients. And I came to St. Croix Hospice as Associate Medical Director in 2011 and was in primary care prior to that for 18 years. And as you mentioned, my great-grandfather was one of the Mayo brothers. And what made the Mayo Clinic great wasn't necessarily because they were the top surgeons. It's that they recognized it took a multidisciplinary approach, a multi-specialty approach to care for patients. And that's the essence of what has made the Mayo Clinic what it is today. And when I started in 2011, working as an associate medical director, I really drew that correlation to what hospice does in providing that team approach to care and to what my ancestors had done in forming the Mayo Clinic. So it really drew me in, that multidisciplinary approach. And, just as the Mayo Clinic has been innovated, I think hospice is a very pioneering field yet. We have a lot of work to do in making hospice much more readily recognized and utilized, and bringing technology and MUSE and machine learning into the picture, I think, continues that pioneering spirit that hospice provides. So, using machine learning really allows us to look at a patient and identify those transition points earlier, and thereby being able to adjust care plans and nursing involvement, aide involvement, chaplain involvement, social work involvement, all at a critical time to better care for the patient and also to support the families.
And that's great. So that's really to bolster the benefits on the patient and the families. I think maybe another question that comes to my mind is, what about caregivers, clinicians themselves? Any impact or benefits there?
Yeah, the ultimate goal as our company, we want to push towards that goal. It may never be attainable, but the aspect that nobody dies alone. And when you have a tool that can increase the presence of clinicians at a time when a patient needs it most, in those last 7 to 3 days of life, being present for the clinicians provides that ability to provide the support for the patient and family. It also provides them with that ability to do what they're trained to do and use their skills at a time when it's most noted or most needed. And for the clinicians, it also provides that opportunity for closure. I mean, they've invested a lot of time, a lot of bonding with patients and their families, and to be there at the end, it's a very valuable circumstance for them to be in.